Here with us today, we have two neurosurgeons, and we're discussing the new spine surgical robot at Baptist Medical Center. Baptist will be the first hospital in Mississippi to use this Mazor X technology. And joining us, Dr. Eric Edmondson and Matthew Van Landingham. I wanted to make sure I got those two right, so let me say it again. Dr. Van Landingham as well as Dr. Eric Edmondson. And let's talk about this new robotic. Why would this help when you're working on a particular spine procedure?
Sure. So the robot is a navigational tool that allows us to place instrumentation, screws, into the spine. And as you can imagine, with the nerves and the spinal cord nearby, it's critical to be accurate in where we're putting in these screws. Now,
what kind of condition would you need to use these screws for? Would it be a back injury? Would it be something that you're born with? Or what exactly would cause you to need this particular procedure?
Sure, Maggie. The most common pathology that I use this for would be to treat a condition called a spondylolisthesis in the low back. That's a slip between one bone and another that results in a narrowing of the spinal canal, frequently leads to back and leg pain, either one or both legs.
And we've got the video of the robot. Now, this seems like it is, again, so precise.
Yes, precise and accurate, and that allows us to optimize the construct. We get to choose the optimal screw diameter so that we can maximize purchase of those screws and the threads. We can maximize the length. Sometimes we need to get purchase in patients with a bone that's less dense than it would optimally be.
Now, Baptist is the first hospital in Mississippi to use this, and you're neurosurgeons. Do we have a lot of cases where people would need this? I know we talk about back pain a lot, but are there a lot of cases where people would need this kind of procedure?
Absolutely. I mean, the fusion procedure that Dr. Amundsen was just describing, that's one of the most common operations that we're performing, and generally we try to do this in a minimally invasive fashion. So the smaller the incision, the more accurate, the more precise you need to be, and the robot is a significant tool in helping us to keep everything minimally invasive.
How does this help the patient in terms of recovery? Does this make the recovery faster?
Well, this technology is, in my professional opinion, uniquely suited for minimally invasive fusions. And minimally invasive fusions do, in fact, result in more rapid recoveries, lower complication rates, so lower amount of blood loss, lower infection rates, and things of that nature. So, yes, everything we do as surgeons is designed to improve patient outcomes, and this is yet another bit of technology that enables us to do that.
In looking at that video and seeing the robot actually at work, so what happens beforehand? How do you determine that a patient is right for this particular procedure?
Well, the robot itself is just a tool in navigating the screws into the correct position. As far as, evaluating the patient for whether or not they be a candidate for surgery, there's a very thorough and lengthy workup involved, usually involving imaging with MRI or CT scans. The robot in particular requires a specialized CT scan. The software creates a three-dimensional reconstruction of the spine, and that's what enables us to guide the screws into position.
Well, I can't thank you enough. Whenever you think spine surgery, it's frightening, but you have made it seem like it, again, just so much technology, so much is changing every day that makes it better for the patient, which is the best outcome.
Absolutely.
All right, thank you both again for being with us.